Case 21 is that of a 69-year-old male with unstable angina. Review of the short axis images demonstrates that the overall wall motion is within normal limits, with perhaps slight hypokinesia of the anteroseptum and anterior wall at the basal level. Review of the next row of images indicates that these are perfusion images, and these are performed with adenosine stress. The subsequent row of images will be the resting images. On these stress images, and one can slow these down to go through them frame by frame, initially the right ventricular cavity is filled, followed by the left ventricular cavity, and then the myocardium. On these images, it is noted that the subendocardium and myocardium of the anteroseptum and anterior wall show a perfusion defect that is persistent throughout the stress images. It is seen on multiple levels as well. This is true at all levels scanned on these short axis perfusion images. The resting images are obtained in the next row, and it is important to note that both the cine, the stress, and the rest images are all obtained in spatially matched locations. The WebPACS format allows one to directly match these and compare them side by side. One can see that no definite perfusion defect is evident on the resting images. The final part of the analysis is that of the delayed enhancement images, which demonstrate only a tiny focus of hyperenhancement, signifying the presence of an infarct in the anteroseptum at the basal level. No infarction is evident in the mid-ventricular or apical levels, as can be seen on these images. In summary, there is an inducible ischemic defect in the anteroseptum and anterior wall from the base to the apical levels without evidence of significant prior infarction. Therefore, this indicates the presence of inducible ischemia with only a small focus of prior infarction seen. This can be confirmed on review of the diagnosis, which indicates that indeed anteroseptal and anterior wall ischemia is noted. The discussion also references two recent papers describing the use of adenosine stress perfusion MRI for the detection of coronary artery disease.